Hi, I'm Dr. Felicia Wolf. I'm a staff psychologist here at the Menninger Clinic, working with the adolescents and the young adults. So yeah, ADHD, if we think about sort of the long form of it, is attention deficit hyperactivity disorder. And so we're looking at two different things there, two different sort of parts to it. We're looking at struggles with attention, with focus, with concentration, and we're also looking at hyperactivity and impulsivity. So individuals can have the one, they can have the other, or they can have both. When we think about myths, often, sort of historically, ADHD has been viewed as a disorder that's really something that kids have, and often associated with kids that were sort of behavior problems in school. And so that sort of still remains sometimes when we talk to individuals in the community. The other myth that we think about is if I am sort of not able to pay attention, if I am kind of disorganized, then people jump to the assumption that, oh, I've probably got ADHD. And that's not quite accurate either. So those are two big ones. Yeah, so it's definitely a piece of what's going on with ADHD, right? Where we can be distracted or hyperactive, but that's just a piece of it. And you have to keep in mind that distractibility, hyperactivity, impulsivity, those can be features of other things going on in our lives. So, what specifically is the mechanism behind ADHD? When we think about that, we're thinking about differences in how our prefrontal cortex develops. So that's this part of our brain right up front here. Um, and that's the part of our brain that is tasked with what we call executive functioning. And essentially, executive functioning is, if you think about an organization, it's like the leadership, the management team. It's telling us what to do, when to do it, sort of breaking up tasks to decide these people are going to do that, those people are going to do this other task, right? So that's the part of our brain that's built a little bit differently with ADHD. And so with that comes difficulties in attention, because if there's multiple streams of information, this part of the brain is struggling to decide, am I going to pay attention to this information or that information? Sort of prioritizing becomes difficult. Same with managing impulses. So when we're thinking about, I have all of these choices and I kind of like this one, not thinking through that and just jumping to it, that's a difficulty that's associated with executive functioning, right? And when that's something that you struggle with, then it shows up in lots of different ways that look pretty impulsive and risk-taking sometimes. So as we were discussing a little bit earlier, ADHD means that there are some differences in how our prefrontal cortex develops, right? So that doesn't go away when you reach adulthood. There's still differences in how you're processing information. And because of that, these struggles can still remain in adulthood. What's different in adulthood is how it presents, right? So, for example, for a little kid who is hyperactive, so has hyperactive type, they might have a hard time sitting still. They might be wiggling around in their chair at school. They might get up and, go for a walk to the trash can 6 times. For an adult, you're probably not going to see that behavior. But what you might see is, well, I'm sitting in a long meeting and it's really hard to sit through that meeting. I might be sort of fidgeting with my pen or moving my chair around a little bit because I still have that impulse, that need for movement. It's just going to look a little bit different. Similarly, in terms of organization, a little kiddo might be forgetting their homework, and an adult probably is not going to completely forget a project at work, right? But what they might do is say, plan a meeting on their calendar, and then someone calls them and says, hey, can we talk about X? And they might start that conversation not realizing that this is going to take me an hour and I have a meeting scheduled in a half an hour. So you're going to see differences in how it presents as an adult in those kinds of areas. So when we're talking about the overdiagnosis, I think it really is a statement that's associated with the increase in the number of ADHD diagnoses that we're seeing today as opposed to some years ago. And that's really associated with the fact that there's more awareness of ADHD now than there was in the past. Often in the past, behaviors that are associated with ADHD were just sort of brushed aside as, oh, this is a kid that is, problematic, or it's a behavioral issue, as opposed to understanding the underlying ADHD behind that. And I think the awareness that comes with social media and a lot of media coverage, has helped with that. In addition to that, I think we have more access to clinicians that are trained to assess for ADHD. That increases the likelihood of someone who may not have gotten the diagnosis seeing a clinician who recognizes the signs and either assessing for ADHD or recommending an assessment by a psychologist or another professional. The last thing we want to think about is the stigma associated with mental health illnesses. So in general, these days, we have less stigma associated with a lot of conditions, including ADHD, which makes it easier for families to reach out to clinicians and seek a mental health diagnosis for something like ADHD because there's less stigma associated with it. I think that's a great question because disorganization and distraction is such a key piece of ADHD. So it's very understandable that people that are feeling particularly disorganized at some point in their life will stop and pause and wonder, do I have this? Do I have ADHD? Is this what's going on for me? What we need to keep in mind is that situational factors, other mental health conditions like anxiety, can cause those symptoms as well, right? So if you're feeling disorganized, but it's time limited, it's because things are really stressful with your family or at work right now, then it's probably not ADHD. What we're looking at with ADHD is this disorganization has been pretty prevalent throughout the lifespan. It might get worse at some points and better at other points, depending on situational stressor, but it's been present throughout the lifespan. And one of the features of ADHD is that it was present in childhood. So it was showing up when you were a little kiddo in school, even if you were able to manage it in a way that helped you function. The other piece with ADHD, like most mental health diagnoses, is we're looking at functionality. Am I able to complete the tasks that I'm expected to complete in my normal day-to-day routine? If my level of distractibility, disorganization rises to the extent where I'm not able to do that, then it's time to start thinking about whether this could be ADHD. The last thing I want to highlight is that ADHD, because it is a difference in how that management portion of your brain works, it's going to show up in multiple situations. So it's not just going to be, I'm disorganized at work. It's going to show up as, I'm disorganized at home too, and I'm struggling to figure out the schedules and routines to get my kids to soccer practice and get dinner on the table and do this and that. It's going to show up with friends where I double book myself and I am, planning to meet up with this friend, but I forgot that I also told this other friend that we could do something else. It's going to show up in multiple contexts. Yeah, so that's a really great question. I think often when we think about ADHD, we're thinking about the behavioral aspect of it. So we're thinking about, am I talking a lot? Am I able to organize myself? We're not thinking about the emotional side of it. And regulation is not just behavioral regulation, it's emotional regulation as well. And so with someone with ADHD, they might get more irritable, they might have lower what we call frustration tolerance, right? So things that, for other people might not bother them as much, it might bother them more easily. And so those are features that can be present with ADHD as well. The other thing that we think about with ADHD is motivation, that sort of impetus that we have to work on a task that might be longer lasting, right? To work on something that is a far reaching goal. That might be harder for individuals with ADHD partly because of that organizational piece. You might have a goal, you might be able to make a goal, but getting there requires a lot of sub-steps to reach it. And with ADHD, the planning of that, the organization of that might be really hard. So that could affect your motivation to actually engage in the things you need to do to reach that goal. The other thing, sort of similar to that, is that there might be decision paralysis. So when you are experiencing a situation where you have multiple choices, how do I choose which one? That requires some thinking and analysis that might be difficult because of those executive functioning deficits, and you might feel a little stuck. I don't know which one to pick, and it's hard to get started on anything because I don't know which one to pick. Yeah, I think that's a great question and really important. So when you are struggling to do this internally, when your ability to sort of manage data and organize it is difficult because of ADHD, you want to externalize it. And you can do that by using planners. Now, this can be sort of the typical paper planner that we use, or it could be on your phone where you set reminders for yourself or use the calendar app on your phone to help yourself organize externally. The other thing that you can work on doing is creating a routine for yourself so that the things that you need to get done become more reflexive, become more habitual, rather than something that you're actively thinking about needing to do. And that way you sort of take the load off of that frontal part of your brain and it just becomes something you do every day. Lastly, you want to think about your social support. You want to think about who can I enroll, who can help me stay on track in a way that still feels supportive. So you don't want individuals that are going to make you feel negatively about yourself, but you do want to think about these are people that can encourage me. If I set a goal and I'm working toward it, they can say, hey, how's that going? Do you need any help? What's getting in your way? And they can support you through the process. So the first thing I would say is that's great. It's great that you're thinking about, is this in the picture? Because it's making you analyze what's going on and it's opening up the door for getting help. Whether or not it's ADHD, if it's prevalent enough that it's on your mind, it's worth exploring. That being said, when we're thinking about ADHD, we're looking to see if this is something that is impacting you in multiple areas of your life, if it's something that is impacting you for a long duration. So as we talked about earlier with ADHD, it is present across the lifespan, even if the presentation changes. So when we're looking at these features, we're also looking to see what is prevalent, what is, upsetting me to the extent that I'm trying to see, do I have a disorder? So what we're looking at is attention and focus difficult? Am I having a hard time sitting through long meetings? When I'm in a meeting, am I having a hard time paying attention to all of the pieces? And when I'm working on a task, is it hard to complete the task? Am I starting something and then getting distracted and jumping off to do something else and then forgetting to come back and complete this task? Are these features present? And if these features are present and they're present across multiple situations in your life, they are impacting your ability to function, then it might be worth considering whether you have ADHD. Similarly, with children, we're looking for inattention and focus. This shows up in places like school. So we want to reach out to the teacher and say, hey, how are they doing in class? I'm telling them to do this task and then I'll come back and they haven't done it. But is that happening in school? Because remember, in ADHD, we're looking at this happening across the board. For kiddos, we're also looking at hyperactivity and impulsivity. So are they sort of blurting out things in class, not waiting to be called on? When they're standing in line, are they sort of really wiggly? Are they having a hard time staying in line? And they're sort of wandering off to the side when they're transitioning from one class to the next. These are things that the teacher can give you information on that can be really helpful to bring to a clinician as you talk about, is ADHD in the mix here?